When you're a new patient at Premier Chiropractic and Performance, you will first begin with an initial consultation. This allows us to find out where you're coming from, where you're at, and what your goals are in the future. We want a thorough understanding of what you've been through and what we're dealing with before we get started with treatment. This is an initial part of the assessment because it allows us to know where we need to start the exam. Most of our exams are started with some type of neurological testing. As seen here, we're doing some muscle testing. We may do some sensory testing of the nerves in the upper and lower extremities, as well as any reflexive testing that may be necessary. Then we get right into our movement screens. What you see here is something called the Selective Functional Movement Assessment. We're having our patient go through what we call top-tier movement assessments. We're going to evaluate the patient's ability to move through a full range of motion, taking a joint-by-joint approach. If the patient is unable to move through a full range of motion in a certain joint or a certain pattern, and/or if it causes pain during this motion, we will further assess this. This will allow us not to chase pain, but to find out exactly what may be causing your low back pain. As I've mentioned before, your low back pain isn't necessarily a low back issue. It could be stemming from a shoulder, it could be stemming from the hip, knee, or ankle. That's why this movement assessment is the foundation of our exams. As we finish our top-tier assessments, we will then go into our breakout sessions. This will take us through our joint-by-joint approach and see if there is a mobility issue or a stability issue. We will also incorporate passive and active ranges of motion. We will also test muscles. We will also test other soft tissues to see if there's a soft tissue restriction or even a joint restriction. This will allow us to know as well what proper treatment we need to perform to get rid of your low back pain. Whether it's a chiropractic adjustment, some soft tissue work such as cupping or grafting, or any other forms of manual release techniques. As you can see in the video, we're taking our patient through ranges of motion throughout the spine. We have to remember that there's three parts of our spine: the cervical, which is our neck, the thoracic, which is our mid-back, and the lumbar, which is our low back. If there is any point of restriction or mobility issue within the spine, it can have effects and compensation issues into other areas of the spine as well. One of our final tests that we'll perform is some balance testing. This will allow us to determine if there's a true stability musculoskeletal issue that we need to deal with, or if we need to dive further into some type of neurological testing. We will also test stability on the table. This will help us determine what position we need to get started in our rehab process. If we need to go into a more stable position, such as the quadruped as seen in the video, or if we can go into a full standing position. After the evaluation process is complete, we will let you know exactly what's causing your low back pain. This is where the real treatment begins. Once you have a complete understanding of what's causing your low back pain, you will have a full understanding of what you need to do about it. Treatment begins when we educate our patients to be their own best doctor. We don't want to be a crutch for your low back pain, but we do want to be there during your healthcare journey. We want to help you as much as we can, educate you as much as we can, so therefore, when your low back pain starts to occur, you know exactly what to do.